The language of pain. Fast forward your recovery to stop hurting. Written by Dr. Trevor Campbell. Narrated by Susan Mcgurl. Disclaimer. This is important. Please read. This book is not intended as a replacement for medical advice or consultation. This publication is a reference guide only and cannot be relied upon for specific and individual medical advice or treatments. Your treating physicians know your history best and treat you on an ongoing basis. The options presented here are mostly based on sound and widely accepted practices at the time of publication. Readers and followers of any of the directions contained in this publication should first consult with their treating physicians before undertaking any of the suggested treatment options in this publication. If any of the activities and disciplines mentioned in this book cause any symptoms of any kind, including increased pain, anxiety, or distress, the activity should be discontinued at once, and you should also seek professional medical advice immediately. The author disclaims all liability and legal responsibility, howsoever caused, for reliance on the information contained in or referenced by this publication. Introduction. I first met Renee, a 47-year-old secretary, almost 8 years after her injury. The accident itself was nothing dramatic. She'd fallen about 2 feet off a small ladder and hurt her left knee. It was twisted and strained, and she had torn the knee cartilage, so she required surgery. She took care of that in short order, and her surgeon declared the procedure a success. Months after the surgery, however, Renee was still experiencing pain. In fact, contrary to her expectations, the pain was getting worse. At this point in her supposed recovery process, Renee reluctantly agreed to attend a multidisciplinary pain management program, but it proved too difficult for her to maintain. She described the program as being too heavy for her, which led her to walk out after only 2 weeks. Later on, she realized her early departure from the program had been a mistake. She still had horrible pain months later, which was why she was talking to me. She wasn't particularly pleased with my line of questioning at first, though. In fact, she became quite agitated when I asked about depression symptoms. Below is my recollection, more or less, of our dialogue. "Forget depression," she replied. "How about extremely angry, as in ripping someone's head off?" I had heard similar responses before, so I was ready with my next question. "What has made you most angry?" I asked. She looked up at me. "You got a couple of hours, Doc?" "Let's at least make a start," I suggested. "I'm angry because every second Doc tells me that the pain is in my head when I only ever feel it in my knee," she explained. "And then they go on and on about how I must educate myself and change." Her face flushed. "Well, I've done that already. I've gone from terrible to way worse." She could no longer hold the tears back. "What have you learned, Renee?" She shrugged. "Not a lot. I ended up going back online, but it's depressing." "Have you read any books or manuals?" "Quite a few, actually. At least, I tried to." "How did that work for you?" She sighed. "The advice is always a pile of stuff that you have to do every day, like an extra job. No, 2 jobs. Don't they realize that I have 0 energy, that I barely sleep at night, that my life is wrecked, and that, yes, I am depressed?" Again she wiped her cheek. "All those to-do lists, brain chemicals, scales, and diaries? Forget it." I have heard stories like Renee's too many times. People in chronic pain are doing their best just to get through the day. They need help, not more to-do lists crammed with seemingly random tasks. That's why I wrote this book, to give people in chronic pain something simple that they can use to get better.
Sample complete. Ready to continue?